Hey, good evening, friends. Jai Hind and Hare Krishna. This short video of about 5 to 7 minutes, we are going to discuss about SOAP notes. This is just one of the series on subjective, right? There will be one more presentation on objective, one more on assessment, one more on plan that will continue with this. Right now, from second year of Form D, everyone talks about SOAP notes, SOAP notes. Typically, we collect the case, we write everything and present it on a PPT and spiral bind it or record into our books, and then we submit it and we go ahead. Now, let us understand what is the importance of SOAP, what is subjective, what is objective. If we have clarity, we will be able to do much better a job. Right. So now subjective, objective, let us compare and contrast. Right. Subjective are those things which the patient or the caregiver tells. And objective are those things that are confirmed through diagnostic tests, lab values, radiological examinations, culture tests, sensitivity tests, all those things. Right. Now let us dive deep into subjective only after analyzing the difference between subjective and objective. Right, please understand, subject or the patient or the caregiver, whatsoever they say becomes subjective. Right, it is an assumption, they are personal opinions, whereas objective is not an assumption, it is a fact. They are unbiased and they are balanced observations or facts for which you have got a proof, like a lab report, like an increased HbA1c level, increased hemoglobin, increased some of the blood parameters which we want to see for any particular disease, like kidney function test, liver function test, chest X-ray, CT scan, MRI, whatsoever it is, like angiography or whatever it is. Right. So now subjective is all unverified, right? And so based on unverified facts, we will not be able to take decisions. But on verified facts, for which there is a proof, for which there is a evidence, we will be able to take decisions. So based on subjective things, we don't take decisions. Based on objective things, we take decisions, because decisions are based on science, based on research, they can be proved, they can be measured, and they are systematic. So objective is something which the facility or the hospital or the doctor or the clinician is able to understand, or is able to find out on what diagnosis it is based on the facts that he has received from various tried, tested, trusted methods like laboratory examinations, blood tests, urine tests, stool tests, and all those things, including the radiological examinations, etc. Whereas the subjective are things which the patient or the caregiver says, which are assumptions, which are personal opinions, which are unverified facts. We have to believe what the patient says. I am feeling palpitations. I was sweating for the last 1 or 2 days. I'm pale and so I am anemic. So because of just being pale, you cannot say that you are anemic. The patient says I am pale and I feel I am anemic, right? But systematically, when you see about the objective test, we will be testing the hemoglobin levels, the RBC levels, the iron stores in the body, and then we decide that yes, this is an anemia. Right, now the objective things we will be discussing in the next session. Now, with respect to the subjective things, right, it will not be limited, right? Whenever we talk of subjective things, the patient came with so and so complaint. This is the age of the patient. We start with the introductory sentence and we close it, right? See, subjective is everything, whatever we can take information from the patient has to be taken. It is a kind of medication history interview that has to be, conversed or augmented or integrated into the SOAP notes, where we have to give all ears to the patient or to the caregiver. We have to listen. See, you must have heard many doctors are very famous and they become, they achieve heights of success because they simply listen, right? So, listening is very important because they are patient and we need to have patience first. First, listen completely and try to dig deep into whatever information that you can get in subjective. This may include family history, his health history, his medication history, his surgical history. See, after 10 years, a patient might have forgotten any surgery that he has undergone. But we need to know that his immune system is very less. He might have undergone a tonsillitis, he might have undergone an adenoiditis, adenoidectomy, and all those things, right? So we need to correlate all the happenings in the past and try to find out if there is any relativity between those and this, right? So the family history, the health history, the medication history, the surgical history, everything that we discussed in patient medication interview has to come over here, right? There is a presentation which is already available in the same channel. You can go through that. Now next is the practices, practicing food, practice of habits like, smoking, alcohol. Many people write non-vegetarian, simple, that's it. So non-vegetarian is not the only thing that you need to note down in the food. Some people might not like to take breakfast, some people might not be taking their lunch, some people might not be taking certain fruits or vegetables, some people might be completely relying on fast food. So all those things have to be brought down here. Next is we need to listen, dig deep, ask for all the past records and check yourselves once. Just they say is not enough. We can just check the past records also to understand what they say is right or wrong or how far it is right, right? And then you can check with the caregiver also, because one person who may be in panic, there is something called white coat hypertension, I hope you know. The moment some people get into the hospital, they see the doctors, they see the facilities, there is some amount of increase in the blood pressure, hypertension, and that may give a wrong value also. So there may be a panic, there may be impatience, there may be some amount of unhappiness which is lying with the patient because he is suffering from some pain or he is suffering from some disease. So his feelings and other things, his personal views also can be checked with the caregiver or whomsoever is accompanying him. Now, again, come back to subjective, where we say what are the chief complaints. What he says or she says as a chief complaint has to be noted down. Chest pain, decreased appetite, shortness of breath, anything can be the chief complaint. And history of present illness, like, when did this start? Where did this start? In which location of the body? What is the severity? He is not able to tolerate the pain, or in a simple pain scale he is at 6 or 7, he needs an injection immediately or an attention immediately, or whatever it is, like, it radiates, like, the chest pain or the angina which radiates starting from the left under the arm, it goes till the wrist, or is that something like that? He is not able to walk with his right leg in a proper position, or he is able to walk, he is not able to sit on the ground, and he is not able to stand after that, or if he stands he is not able to sit after that. He is having a right backside pain whenever he walks, always, so like that. So no, when did it start? When, what, where, why, who, how, all those things have to be understood about the present illness. Then just a system review, right? Did you lose weight, or is there a weight gain, or it is a general, like gastrointestinal system, respiratory system, it is going to be musculoskeletal system, which system the pain is, or which system the problem is. So those things can be analyzed and understood in the subjective part of it. Now the current medications that he is taking and allergies, sometimes we can take it as subjective, sometimes we can take it as objective. If there are proofs, if there are records which he is taking, and if you feel the adherence is good, it will become a partly objective thing. And if he does not have any records, if he is going to tell this orally, because in a hurry during emergencies they don't carry the past record, so it will become subjective if it is going to be current medication without records, right? So this will become a part of both subjective and objective. So please understand, the process of taking a subjective note is not just to say that 59-year-old male patient was admitted with this complaint. That's it. So his family history, his health history, his medication history, what are the practices that he is doing, like in terms of food, in terms of smoking, alcohol, social habits, listening to him and identifying his feelings, his views, chief complaints, history of present illnesses, and a general system review. All these things have to be done under subjective. This fairly gives an idea of what are the belief systems of the patient, as well as his current position. so that with the objective, and when you plan the assessment and other things in future, the subjective will be of some use to you, right? So please try to understand that. Don't limit it with what the format or the presentation says. Don't do it for that. Idea of subjective is to take as much information possible from the patient, and so it need not be limited to what is given in a format. The idea is to understand the patient's problems completely from his point of view. Again, please remember that subjective is not for taking decisions. That, like, it's like a newspaper news or biographies or something like that. They are their opinions, they have told everything. Half of the problem will be solved when we patiently listen, note down everything, and communicate it properly. So that is where subjective is very much important. We need to listen, 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 question and listen, dig deep, and take answers as much as possible to understand the conditions of the patient, the beliefs of the patient, the current medications, the chief complaints, the history of the chief present illness or the complaints, and a general system review, and his current medication and allergies, if any, will all be a part of the subjective assessment. Objective assessment plan, all this will be coming up in the next few sessions. Thank you.